My name is Matthew Knipling. I'm from Thlandu, South Dakota, and I actually work up here in Brookings for SDSU Extension. I have a son, Liam, who's 11, Jillian, 9, and then my wife, Erica. We had to bring in Liam, who's 11 now, in because we weren't really sure what was going on. He just didn't act right and seemed to feel right. So we brought him into the hospital, and they did like a quick scan and asked him some questions, and then they found out that his appendix had burst. So at first it was just more of a flu bug or something going around, because he wasn't complaining about it really hurt. It was more of uncomfortable. So whether his appendix had burst at that time, we didn't know, because he wasn't really complaining about a lot of pain. We thought it was just some regular flu bug going around. But then by the time Sunday came around and he didn't really want to eat, didn't want to get up and move around anymore, then we figured that something a little bit more was wrong. And so we brought him in here to Brookings, and like right away the ED staff, asked him a few questions just to kind of get started. Brought him in for a scan, and then it was like right away they could tell that it was his appendix was either having problems or had ruptured. So we've had both of our kids here come here for all of our health concerns and needs. Jillian actually came here and had her tonsils and adenoids taken out, and so it's just been a really nice place to come, and we've always gotten great care here. Dr. Johnson put Liam at ease by talking to Liam, not just explaining to us what was happening and answering our questions. They talked to him, really going over the process and telling him that he'd done it so many times, and explaining it to him that it was, something he was really comfortable with, answering all of Liam's questions with, in terms that he would understand, and not really overcomplicating it. Liam was in the hospital for about 2 days after his surgery. He came in Sunday afternoon and then left Tuesday afternoon. At first he was really quiet and lethargic again, kind of like he was before, but just as they kept checking on him, he felt better and better. And after a little bit, he kind of had to apologize because he felt like he didn't want them to feel like he was ignoring them, because as he felt better, he was moving around more and just slowly started to interact with them more. And then, like he said, they were always talking to him, and that made him feel really comfortable and kind of helped with the recovery, I think. He liked that when the doctors came in that they talked to him, and then they would ask if we had any questions, but they would come and talk to him first, and he was their priority, which kind of made us feel better too. You could say it felt like we were VIPs, but it seems like every time we've been here they've treated us like that. So it's kind of I think they treat everyone equally as well. Like they all came in and were talking to him and introduced themselves, and when he started feeling better, he would go out and say hi to them, and they would introduce or say hi as well, and just made him feel like he was kind of at home. It's really nice having the options that we do, but I think we would have been more of just, like I said before, another number, and not have the attention that we would have gotten, and having it this close. That way we could run back and forth to home to get everything that we needed. It was really nice being in the expansion or the new rooms. They really felt comfortable, and since we were here for a few days, it was kind of a nice room to be in. We were pretty worried when they told us that it was his appendix that had ruptured, but I think that when they came out and actually talked to us and answered all of our questions and his questions, it kind of put us at ease a little bit more.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.